From the campus of the University of Kentucky, you're listening to Behind the Blue. I'm Cody Kaiser with UK Strategic Communications.
It is such a blessing, very intense at times, but I get invited in and our team gets invited in times when people feel most vulnerable. When their child is sick, they don't know what's going to happen. There's a lot of fear and uncertainty. And our team specializes in really trying to make things clear. What are the choices? Can we talk about the hard things? And that really helps people feel more grounded. What helps drive them to make decisions when it's like the worst day of their life? If we can make any silver lining in that, it really helps us with our job. So I feel so blessed to meet some of the most courageous families I've ever met in a time when their child is sick and in peril. It is so scary. And I feel very blessed really being able to be in that moment with him.
That's Dr. Lindsay Ragsdale, Chief Medical Officer for Golisano Children at UK. From College of Medicine research labs to the halls of UK healthcare, Dr. Ragsdale has spent much of her career here at the University of Kentucky. Now she oversees a growing team of specialists and subspecialists dedicated to providing the most complex care for the children of Kentucky. On this episode of Behind the Blue, Ragsdale joins my colleague Allison Perry to discuss her career at UK, the role of palliative care, the growth of the Children's Hospital, and her own son's experience as a pediatric cardiology patient. As a Woman of Impact nominee for the American Heart Association's current fundraising campaign, she also highlights how AHA helps fund an important initiative overseen by a Golisano team, Project Adam in Kentucky.
Thank you, Dr. Ragsdale, for joining us here today on Behind the Blue.
Thank you. It is a real pleasure to be here today.
I know we're going to get into the Woman of Impact campaign that you've been nominated for here in a little bit, but first, I kind of wanted to start out with a little bit about you and your history here at UK, because you've been here for a while. Just tell me a little bit about your background and ending up at UK Healthcare.
I was originally born in Tennessee, and I realize the orange and blue is coming up soon, so we won't talk about that. But I went to Center College for undergrad and then start out as a researcher in the College of Medicine, and then went to med school and pediatric residency, stayed for my chief year, and really have loved training here. It has been the foundation of the doctor that I am now, for sure. And my husband and I went away to practice at Pittsburgh Children's and Children's of Philadelphia. So we kind of took a tour of Pennsylvania and got recruited back about 13 years ago.
What did you research in the College of Medicine initially?
I was in the Department of Physiology, and we were looking at calcium channels. You'll see the dork come out in me now. We're really looking at, could we prevent damage to the heart after a heart attack? Because really this idea that the channels, even down to the molecules, really matter after a heart attack. And that's really where I got my start.
Did you think you were going to go into research, or were you thinking like research will help me in becoming a physician?
I think it was really a helpful thing for me to test out. I love being curious about questions like, why is this happening? Can we prove it? So it was really the basis for my scientific mind, but I love people. And I think being in the lab really proved to me that I love teamwork. I love building teams. And I really wanted to get into clinical medicine.
And your physician specialty is palliative care.
That's right.
Correct. And you work for the Children's Hospital as well. So I have to imagine that is sometimes a difficult job.
It is such a blessing, very intense at times, but I get invited in and our team gets invited in times when people feel most vulnerable. When their child is sick, they don't know what's going to happen. There's a lot of fear and uncertainty. And our team specializes in really trying to make things clear. What are the choices? Can we talk about the hard things? And that really helps people feel more grounded. What helps drive them to make decisions when it's like the worst day of their life? If we can make any silver lining in that, it really helps us with our job. So I feel so blessed to meet some of the most courageous families I've ever met in a time when their child is sick and in peril. It is so scary. And I feel very blessed really being able to be in that moment with him.
Were you drawn to this field initially, or is this something you kind of discovered once you were getting into medicine?
I discovered it along the way. I could not fall in love with one single organ. We're a weird field in that you fall in love with organs, like the nephrologists love the kidneys or love the heart if you're a cardiologist. And that did not resonate as much with me, but I loved family and I loved figuring out what makes people tick and why do they make decisions and what about the context of their lives. And I wanted to go and talk when things are really tough. I should have seen this thread for my life, but I didn't at the time. We actually didn't even have palliative care here as a field. And I had some very intense clinical experiences that led me to find a specialty that really comes in with a different mindset than medical specialties do, to find out where the family is, what's happening, what gives them support, how can we help really wade through these hard times. It's a different kind of medicine. I do a lot of pain and symptom management. So we're kind of the creative thinkers, thinking outside the box about how we can help in multiple domains of life. And I have really enjoyed that. That really connected with my ethos or my feeling about medicine being thinking about the total human and not just one organ. We need those people. Like, they're amazing. I have so much respect for all of our teams, but it has been really amazing to see the multiple dimensions of care. And we really should pay attention to all of them.
And if for anyone listening who may not understand what palliative care really means, and most people I talk to just think it means hospice.
Yeah.
Is there anything you want to say about kind of the full scope of what you all do, the palliative care team does, especially at the Children's Hospital?
Yeah, a lot of people think that when they hear palliative care, they think it's really just end-of-life care. Hospice really is designed to take care of patients at end of life, really less than 6 months of life. We can think of this as a time frame. Palliative care can get involved at any point in the illness, at diagnosis, really anywhere along the way where it's impacting their life. For us, we want to get involved and understand what makes a family feel whole and connected and grounded. And we can do that anytime along the illness. So don't be afraid if you hear palliative care coming in, say, yes, we want them. They're the additional team that you would want on your side if you're really facing a lot of scary, serious things. We are not here just to talk about death and dying. This is a different specialty than the hospice team is. So we're really an interdisciplinary team there for serious illness.
Before we get into what your current role is there anything, I know you talked about palliative care didn't exist kind of before you came on, anything that you're particularly proud of that you and your team have been able to bring to UK healthcare?
I am so proud of our team. We really built this from the ground up along the way. I have other physicians, nurse practitioner, bereavement coordinator, pharmacists, nurses, chaplains that all collaborate on patient care. And we have been really able to establish an entire new field at the Children's Hospital. And this is the same on the adult side. We're growing this from the ground up. And I am really proud of the care that we've been able to give and the real partnership that we have with all the medical teams, where we say, tell us what's happening. How can we help? How can we be creative? It's a very individualized way of caring for patients. And really, that's what I wanted to do when I trained here and realized palliative care didn't exist as a field here. I really want to go get training and come back and teach people how to have good conversations, to be clear with communication. It's something I've felt very passionate about. Now I've kind of transitioned a lot of my time, but I am so proud of my teammates who have really been so dedicated to their patients.
I would say you have transitioned to become the Chief Medical Officer for Golisano Children's at UK, formerly Kentucky Children's Hospital. We got a significant donation that renamed the Children's Hospital last fall. Tell me what You've been in this role a few years. I can't remember exactly when you were named CMO, but tell me a little bit about what your job looks like now.
Yeah, this is really going over 5 years now. I started this role really during COVID. And right, really the first day when I stepped into this role, we really needed a surge plan. This is when COVID started affecting children and it hadn't before. And I started to see our hospital as a large system connected to the adult hospital that needed, again, this kind of thoughtful way that we think of children's care, and have really been amazed at the growth in the past 5 years of our children's hospital. We have grown in complexity, in number of patients, number of beds. We've grown by leaps and bounds. I am really so thankful for the teams, the patients, and really all of the care is really highly tuned to do safe care every single day. And that is a real sense of pride for me. I am amazed at the people that get up every single day dedicated to their pediatric patient. You can see it, you can feel it every single day. We're on huddles talking about, hey, how can we make this better? How can we make this safer? Let's be proactive. And people really get that. They really love what they do.
Or even thinking just the past few years, I've been here since 2009 at UK Healthcare, but I know my colleague Hillary wrote a story about kind of the history of the Children's Hospital. It was like 25-year anniversary, and there was a line in there about how it started as just like a floor. That's an original Chandler, and now it's literally a hospital within a hospital. And even just thinking the forensic clinic that opened recently, the behavioral health unit that opened. And I don't know if there are any other kind of major initiatives in the past couple of years that you think have been really, really important for the hospital to add.
Yeah, I think those are great ones to name. We have added subspecialists where in the past we might have had one subspecialist in this one field. Now we are adding multiple layers of subspecialties. So when I say complexity, it's not that we just have pediatric surgery. We have surgeons that are interested in subspecialties of pediatric surgery. We have really been able to meet the needs of the children in Kentucky so they don't have to leave the state. It's really what this is about, to create a healthier Kentucky. That's not just a motto. It is something that we live and breathe every day for our pediatric patients. We have had an amazing collaboration with Cincinnati Children's for our CT surgery program. We have a connection with them with our cancer team, radiology. We have been able to grow and collaborate even within our region to keep patients here in the state. That has been highly successful for us. In a time in the past 5 years where some of the regional hospitals have not been able to maintain their pediatric inpatient teams, we have been able to grow and expand. I give a lot of credit to the leaders of UK Healthcare to seeing the Children's Hospital and being able to allow us to grow and flourish like we have. I think that we have a seat at the table just like the other hospitals do. And I think that's been a really big frame shift to seeing us in a way that we've never seen before.
So one of the main reason that we invited you here today is that you have been nominated as a, quote, woman of impact to fundraise for the American Heart Association. Is there anything you want to, I know you were nominated, you didn't volunteer yourself, but can you tell us a little bit about that campaign and what your goal is?
I am so honored. Even hearing you say that, it makes me feel a little bit of an imposter syndrome, but I feel very pleased to really try to help raise awareness for heart care, especially for pediatrics. The American Heart Association is a strategic partner for Project Adam, and that's really what I'd like to focus on today. Is Project Adam was really built on a patient who was 17, and he was on the basketball court and had a cardiac arrest. And they didn't know this was coming. This was unexpected, and he ended up dying on the court. So his family and team developed Project Adam. It's a national project that helps community sites have training for hands-only CPR and for an AED where you can put the pads on and shock the heart if it's in a rhythm that is not sustainable. And for me, this is something that I care deeply about our community and being safe, all kids being safe at school or on the field. But I think personally it hits home because my own son, who's now thriving, he's 9, but had congenital heart disease that was unknown at birth. So we've been really thoughtful as a family about what does it look like to protect him, because we went through some scary times in the NICU when he was born, and thinking about how do we know that we're prepared if something were to happen, not only for my child, for any child, any adult can use all of these rescue needs if happened. So I am very pleased to help talk about Project Adam and try to raise money and awareness that any community site can register to become a heart-safe location. Our UK team, Mindy and Tanya and Dr. Mohan, I just want to call them out. They're amazing, part of our Project Adam team. They can come out and help with a drill, help make sure that that each community site has what they need equipment-wise, so that in the case of an emergency, they're already prepared. I mean, you hope this never happens, but you want the insurance that if you needed critical cardiac response, that you got a plan, you just enact it, you have the equipment, everybody knows where it is. These are things that we can do as a community. There's some things we don't have cures for, but we have the equipment. We have what we need to help protect kids at school, kids on the field.
When we moved into our new building, new being an interesting word, it's an old building, new to us, but there's no AED in that building. There's not really even an AED very close because we're on the edge of campus, and asked and had money in the budget to buy one. So I'm the administrator. I'm the one who checks on our AED every month and sends the report that it's still, operational and functioning. But years ago, I was teaching a fitness class and a woman had a sudden cardiac arrest in class. And I had never that was the first time seeing an AED used in real life. And unfortunately, they weren't able to bring her back. But that just kind of really, she was a very fit person. And I knew people who knew her and they were like, she had no known history. And that just really struck home with me about how important it is to be able to have access to those. And, and people don't think of children as, suddenly having an issue like that, but why not have it there just in case? And you make sure there's people who know how to use it.
Yeah, I think that's exactly right. There are times that you might not have any symptoms at all. You might not know that your heart has a different shape, or maybe you were born with something and it's never caused any trouble until you're exercising or until something happens. I think for children, this is often the case, that they're exerting themselves in sports and they might not have known that they had a congenital heart disease or have a random arrhythmia. So this is really an important piece to have an AED. Even if you have it, you have to know how to use it. So having schools and civic organizations or sports have the ability to have a critical plan and to have the equipment. So to me, this feels really important to our community. And I'm happy to raise money, and along with the American Heart Association, which is for all cardiac care, women, men, children, whatever, they are really here to help us live healthier. And I think that's the part that I can get behind. We want kids to live healthy and long lives, and we need to really have this insurance, the equipment and the preparedness ready.
And I'm going to ask about your son a little bit more, if that's okay. So he's 9 now. So that means you were working here when he was in the NICU. And what was that experience like, going from a provider to the parent of a patient?
That was not easy at all. We didn't expect this. I worked the day that we had him. I did not expect it. We had a healthy pregnancy and had no signs that anything was going to happen. And he came out and really had trouble breathing right at birth and had pulmonary hypertension. This is high blood pressure in your lungs. And then we discovered he had a VSD, or hole in his heart, and all of this happening at once. We were really worried, was he going to make it through? Would he need bypass or ECMO? And these were some scary times. even as a palliative care doc, knowing that this is getting serious. I have been so grateful for the NICU team that really recognized that he was in trouble, started escalating care the minute he needed it. So I am really grateful. And I've had an experience where my own child was in peril. So I definitely feel empathy and a lot of love for families who go through things like this. Could be traumatic. For me, I've done a lot of soul searching about coming back to work. What would that be like? And I've had to see patients back in the same room that he was in, and what is that like? So I've done a lot of human things and thinking through what is it like, and how do I rely on things that give me support, which my husband, my family has been amazing, and he's thriving, which makes me, super excited, and realize that not all families are that, don't go through the same process. So I have just been really thankful to UK and to the NICU, to the cardiac team. They took amazing care of him. And now he's thriving. He's in school. He's doing great. He's hilarious with jokes. And he's been great.
I don't have children, but the NICU seems like such a special place to me because I have had friends who had kids who've been there, and I will go visit them, and they are always so grateful and so complimentary of the care that they get in the NICU. And like, I know seeing like how stressful it is, especially when like I had a friend whose daughter was there for 6 weeks. So she basically had to move up here and live and, to be able to see her every day. But the staff there, I think, are just amazing. Like every time I was in there and they would come in and check on them, it's like they're just so good at their job. Not that other places in UK healthcare aren't, but
right.
It's just such a interesting environment and so stressful for the parents, but they make it as easy as possible.
Yeah, I, of course, am proud of all of our units in the Children's Hospital. The neonatal ICU is really a specialized unit that needs to have this model of care where families come in, and this is unexpected. Nobody plans for this to happen, to have either prematurity or have your child be sick. And there's some grief involved with not having what you see on Facebook. Everybody has this amazing delivery and then they're home in a day or two. There's a lot of emotions that go into having a child in the NICU. And I think that that's the piece that we have grown over the past 5 to 10 years, is more support for psychosocial, mental health, for spiritual wellness, like all of these domains, because it's not just having the medicines and the right equipment and the right ventilator. It's really having the full team around the family to think about what they go through. And you're right, they can stay in the NICU for 6 weeks, 6 months, sometimes a year and a half, depending on their medical diagnosis. So we have to get this right. This is very critical points in the patient's life and really the family's life. We really need to do a good job at this, really throughout all of children's. We have to do a good job at raising the next generation of adults. That is what we're thinking about throughout all of the process, that we don't want kids to be traumatized from seeking medical care, so that when they get older, they'll never come to the doctor, because we have to do a good job at ensuring their comfort and involvement in their healthcare all throughout the lifespan.
And one thing you said that I kind of loved when we met with you, you were like, I've spoken to my son about this and he's in agreement that I can talk about, his care. And I was curious, he's 9. So what have you like told him about, his birthing experience, or like what does he know at this point? And how do you kind of figure out what to tell him as he gets older?
Yeah, he knows, he's seen the pictures. He doesn't remember it, of course, as a baby, but he still has some lung problems and he's been admitted to the hospital a few times. We see some of our subspecialists here. So we've had some times to really unpack what that experience was like for us. And we've been thoughtful about not trying to put him in a bubble and letting him go out and do normal kid things. He's got to develop and have this normal, healthy experience. And also realize that that was not an easy time for us. And how do we think through, how does he make healthy choices for himself? Because he's starting to be able to make choices. And I think that he's a really thoughtful, kind kid who could see that this would be an impact in a family. And we're really proud of him. He has been a real blessing to us. And I can't wait to see what he does in life. Like he's creative and really, really smart. So we'll see what he accomplishes. It's going to be amazing.
And when you think about running the children's hospital for the next however many years, what are like kind of goals or hopes that you think of for Golisano as, you're leading it moving forward in the next few years?
Every kid is important every time. I think that's the piece that I get up every day trying to make sure that our system is well prepared. So we've talked about making sure that we are highly reliable as an organization, that the minute a child enters the healthcare system, we have a system, checks and balances, everybody's working together, communicating well. And if we can do that, I think that that's a really good system we want to maintain because we're growing. And so those are some growing pains that we're under. We're really excited about the future. Could we build? What does it look like? How do we continue to grow? Because our trajectory and our numbers continue to increase. So we're excited about how many more clinics can we add? How many more beds in the inpatient side? What other things that we're not offering now can we offer in the future? I am very excited about that. I think every kid deserves to live healthy and have the best shot at that. And we should be part of that. We're part of this community. And how do we make sure we keep kids in Kentucky and as healthy as possible?
And kind of going back to Project Adam, I know Cody interviewed Dr. Mohan last summer, but that program's kind of, I guess, started in Fayette County, and they started with like one high school at a time. And now all the high schools have been like Heart Safe certified. And it's like they're kind of trying to go out across Kentucky and make sure that more people, especially in rural areas, are learning this and getting access. Is there anything you want to say about fundraising for American Heart and being able to see kind of a direct impact? A lot of people want to give and know kind of where some of their dollars are going.
Yeah, absolutely. Each organization that reaches out and said, we want to be heart safe, it's at no cost to them. So that is really where the funding goes for Project Adam, is to pay for the infrastructure and the equipment needed to make sure that these organizations have what they need. Our team has been highly enthusiastic about reaching out to other counties, other school systems. We would really like to see, especially the schools, participate. So if there's anybody out there in the Board of Education or other counties that have been interested in this, please reach out. Our team really wants to help make the schools heart safe. You never know when you're going to need this, and it's crucial when you do. So we'd like to really expand to other school systems, other sports organizations or civic organizations. We'd love to partner. So really, the American Heart Association takes those funds and helps with the equipment and the support for Project Adam. And we are really excited about trying to spread that word. The groups who have done Heart Safe are so proud of the work that they've done after they have their response plan, they've drilled it, they've gotten their certification and have all the equipment. It is a sense of pride because now you know you have what you need in case of an emergency.
So if people are interested in donating to this campaign, and especially donating in your name, what can they do?
There's multiple nominees for the Woman of Impact. So some healthy competition. And I think some of the other nominees are other healthcare organizations. So there's some competition there. UK would love to come out ahead. But the campaign starts February 6th at 9 a.m. and it goes through April 9th at 9 p.m. And during that time frame, if you want to go to the website and click on my nominee form, and all of the donations that are through that website get tallied up, and there's a competition, of course, but really it goes to a good cause to really help Project Adam and American Heart Association make sure that we can have all that we need to make the area's heart safe. If there's other questions, there's a website that we're happy to share.
All right. Is there anything that I haven't asked you about, either in terms of your experience at UK Healthcare or with the Children's Hospital, either in a past role or a current role?
I think the important thing for families and organizations to think about is to have a plan. And that's really what Project Adam is here for. Of course, the Children's Hospital really is building a cardiac program. We want patients to seek care when they need it. We have really reached out to the community to make sure that kids in the Commonwealth have the cardiac care that they need. And really, this is an extension of that cardiac care that we give with surgeries and things on the inpatient side. We want to make sure that the community sites are protected as well. I want my son to go to a school that it's heart safe, that has an AED, that has a plan. And I'm sure the same for you. If you have kids in your life or family members that are at risk, you want them to be at a place that if there's a crucial emergency, they have what they need.
All right. Well, thank you, Dr. Ragsdale, for joining us here on Behind the Blue. And I mean, we're a little biased, so obviously we hope you win this campaign, but thank you so much.
Thank you. My pleasure.
The American Heart Association's Woman of Impact campaign begins Friday, February 6th at 9 a.m. Eastern Time and ends Thursday, April 9th at 9 p.m. Eastern Time. To learn more about the campaign and to donate, you can visit Dr. Ragsdale's donor page on the site at ukhealthcare.com/Woman of Impact. Thanks for listening to Behind the Blue. Behind the Blue is a production of the University of Kentucky. For more stories about how the University of Kentucky is advancing our Commonwealth, visit uknow.uky.edu.